Hello everyone, I'm Sabiha and I'm here to teach you the anatomy of parotid gland. Let's see. First, let's look at the contents. We'll be talking about the location, boundaries, capsule, external features, relations, structures within the gland, parotid duct, blood supply, nerve supply, lymphatic drainage, and applied anatomy. So before starting, let me give you a brief introduction about the parotid gland. It is the largest salivary gland present in the human body out of the three salivary glands. It is of serous type. It produces saliva and keeps the oral cavity moist. It also helps in swallowing and chewing, which is the basic function of all the salivary glands. Now let's look at the location. Where is it exactly located? The location of the parotid gland is in the parotid region. From the word parotid, it means that para, which means around, and otic, which means ear. So it's basically located around the ears. To be more specific, it is located in the pyramidal fossa, posterior to the ramus of mandible. As you can see in the figure, this is the location of the parotid gland. It is also known as the parotid bed due to the muscles underlying the parotid gland and giving a cushion-like effect to the gland. Now let's look at the boundaries of the parotid bed. Anteriorly, as you can see here, it is bounded by the posterior border of the ramus of the mandible and posteriorly by the mastoid process. This is the mastoid process. Superiorly by the external acoustic meatus and medially by the styloid process. So these are the boundaries of the parotid bed, so you might be clear with the location of the parotid gland. Now let's talk about the coverings. It is also known as the capsule. The parotid gland got two capsules. First one is known as the true capsule, the other one is known as the false capsule. It is known as true capsule because it is formed by the condensation of the fibrous stroma of the gland itself. The other one is known as false capsule because it is derived from the investing layer of deep cervical fascia. The deep cervical fascia got three parts and investing layer is one of them. So false capsule is derived from the investing layer of the deep cervical fascia. It is also known as the parotid sheath. Now how does this investing layer form the false capsule around the parotid gland? It splits. The investing layer splits at the level of the base of the mandible into two. One, the superficial lamella, as you can see here, and the deep lamella. The superficial lamella blends with the parotidomesenteric fascia, as you can see here. This is the parotidomesenteric fascia. It blends with the parotidomesenteric fascia and gets attached to this zygomatic arch. The deep lamella blends with the stylomandibular ligament and gets attached to the tympanic plate and the styloid process. The stylomandibular ligament, as you can see here, separates the parotid from the submandibular gland. This is an important point to remember. Okay, let's continue. Next, we'll be speaking about the external features of the gland. As it is very much evident from the picture that the parotid gland is an inverted three-sided pyramid. It weighs approximately 15 to 25 grams. The presenting parts of the parotid gland are, it has got an apex, you can see here, this is the apex, and a base, which is also known as the superior surface, and three surfaces and three borders. The three surfaces of the parotid gland are the superficial or the lateral surface. From the name itself, it is superficial, that is, we can view it from outside. And the other two surfaces are the anterior medial and the posterior medial surfaces. Both of these surfaces are towards inboard. As you can see in this picture, this is the superficial surface, this is the anterior medial surface, and this is the posterior medial surface. From this picture, this is how the parotid gland is. This becomes the superficial surface, this is the base, that is the superior surface, and this side becomes the posterior medial, and this is the anterior medial surface. This is the apex. Now the three borders are the anterior border, the posterior border, and the medial border. As you can see in this picture, this is the anterior border, This is the medial border and this is the posterior border of the parotid gland. This is the horizontal section of the parotid gland taken. Now let's get into the relations of parotid gland. First of all, we'll talk about the apex. Apex, as you can see in the picture, it is directed downwards. It overlaps the posterior belly of digastric muscle. It also appears in the carotid triangle of the neck. Now the structures passing through the apex are the cervical branch of facial nerve, the anterior division and the posterior division of retromandibular vein. So the three structures passing through the apex are the cervical branch of facial nerve, anterior division of retromandibular vein and the posterior division of retromandibular vein. The relations are very easy to remember when you study with the picture. Now let's talk about the base. Base is directed upwards, as you can see here, and it is pretty much concave. It is related to the external acoustic meatus. This is the external acoustic meatus. And also a small part of the temporomandibular joint, that is the posterior part. Now the structures passing through the base are the temporal branch of facial nerve. This is the temporal branch of facial nerve, the superficial temporal vessels and the auriculotemporal nerve. So these three are the structures passing through the base. The temporal branch of facial nerve, superficial temporal vessels and auriculotemporal nerve. Next is superficial or lateral surface. As I've said earlier, superficial is something we can view from outside. So the relations are skin. From outside to inwards, the relations are skin, superficial fascia with lymph nodes and great auricular nerve, posterior fibers of platysma, which is a muscle, and superficial lamella of parotid sheath. The relations of superficial surface are very easy. It is the skin, the superficial fascia with lymph nodes and great auricular nerve, and posterior fibers of platysma, superficial lamella of parotid sheath. That is the parotidomesenteric fascia. Next, we'll go on to the anterior medial surface. This surface is grooved. As you can see here, this is the groove. It is grooved for the ramus of mandible. The ramus of mandible is directly related to the anterior medial surface. So the relations of anterior medial surface are the ramus of mandible and the two muscles related to the ramus of mandible, that is the masseter and medial pterygoid muscle. And capsule of temporomandibular joint also forms the relation of anterior medial surface. Next, we'll go on to the posterior medial surface. As you can see here, it is an extensive surface. This is the posterior medial surface. The relations are the mastoid process with its attached muscles, that is the sternocleidomastoid and posterior belly of digastric. Next is the styloid process with its attached muscles. And deep to the styloid, the posterior medial surface is related to the internal carotid artery, internal jugular vein and the last four cranial nerves. And as you can see here, the facial nerve enters into the gland through the posterior medial surface. So the relations, as you can see here, are the mastoid process and its muscles, styloid process and its muscles, and the facial nerve enters the gland through this surface. Okay, and next we'll go on to the borders. The anterior border, as you can see here, it rests on the masseter muscle. Through this border, the structures that come out are the zygomatic branch of facial nerve, transverse facial vessels, that is the branches of superficial temporal vessels, upper buccal branch of facial nerve, and this green one is the parotid duct, and lower buccal branch of facial nerve and marginal mandibular branch of facial nerve. These are the structures that come out through the anterior border. Next, the posterior border. The posterior border rests on the sternocleidomastoid muscle. The structures passing through this border are the posterior auricular branch of facial nerve and posterior auricular vessels, that is the artery and vein. So it's easy to remember the posterior auricular branch of facial nerve and posterior auricular vessels. The medial border is very easy. It just has got one relation, that is the wall of pharynx. This is the wall of pharynx. So the medial border is directly related to the wall of pharynx. So when you study with this picture, all the relations are very easy to study and remember. You need to get the proper orientation of where the gland is located, and the relation becomes very easy to understand and study. Now let's look at the structures within the gland. What are the structures that are actually within the gland? So the structures are, that is from outside to inward, it is the facial nerve, as we have said earlier. It enters through the posterior medial surface, then the retromandibular vein and the external carotid artery. These three are the main structures present within the gland, that are the facial nerve, retromandibular vein and external carotid artery. There are also parotid lymph nodes and part of auricular temporal nerve within the gland. Next we'll talk about the facial nerve. Facial nerve enters through the posterior medial surface and divides into two divisions or two branches within the gland, that is the temporofacial division and the cervicofacial division. The temporofacial division further divides into the temporal branch and the zygomatic branch, and the cervicofacial division further divides into the buccal branch, marginal mandibular branch and the cervical branch. This is how you study the 5 branches of the facial nerve: temporal, zygomatic, buccal, mandibular, cervical. Temporal is related to the base. These 3 are related to the anterior border, and cervical branch is related to the apex. Branching pattern of this facial nerve is known as pes anserinus. That is, the 5 branches radiate like goose's foot through the anterior border of gland. Branches of facial nerve divide the gland into superficial and deep parts or lobes connected by the isthmus of the glandular tissue. Next we'll be speaking about the parotid duct or Stensen's duct. All the 3 salivary glands has got its own duct to open into the mouth. The parotid duct, as you can see here, the green one is the parotid duct. It is 5 cm long and 3 mm wide. It emerges through the anterior border. We have said that earlier. It emerges through the anterior border of the gland. It runs on the masseter between the upper and lower buccal branches. At the anterior border of masseter, as you can see here, this is the anterior border of masseter. At the anterior border of masseter, it turns medial or inwards. Okay, now the structures pierced by the parotid duct in order are, as you can see here, the buccal pad of fat, the buccopharyngeal fascia, the buccinator muscle, and then it runs between the buccinator muscle and the mucous membrane of cheek and opens into the vestibule of mouth exactly at the crown of upper second molar teeth. So it's said to take 3 turns, that is the first 90-degree turn when it pierces the buccal pad of fat, and the next 90-degree turn when it runs between the mucous membrane of cheek and buccinator muscle, and the third 90-degree turn when it enters the vestibule of mouth. That's about the parotid duct. Next, the blood supply of the parotid gland. The arterial supply of the parotid gland is derived from the branches of external carotid artery, that is the superficial temporal artery which runs upward, and the maxillary artery. Venous drainage of the parotid gland. It drains into retromandibular and external jugular vein. All of this are related to the parotid gland. Next, the nerve supply. Speaking about the nerve supply, it got 3 types of nerve supply, that is the parasympathetic, which is secretomotor, sympathetic, which is secretomotor, and vasomotor, and sensory, which is by the auricular temporal nerve. Now the secretomotor pathway, the parasympathetic pathway. It has got 2 parts, the preganglionic and the postganglionic. The preganglionic fibers begins from the inferior salivatory nucleus. It passes through the glossopharyngeal nerve and then the tympanic branch of glossopharyngeal nerve, then through the tympanic plexus and lesser petrosal nerve. It relays in the otic ganglion. So this is the preganglionic pathway, the preganglionic fibers. This is very important to know. And the postganglionic neuron from the otic ganglion, it passes through the postganglionic fibers and through the auriculotemporal nerve, it innervates the parotid gland. So this is all about the parasympathetic pathway. Now the lymphatic drainage. It drains into two groups of lymph nodes, that is superficial parotid nodes and deep parotid nodes. The lymph from the superficial fascia is drained into the superficial parotid nodes, and the lymph within the gland is drained into deep parotid nodes. Efferents drains into the jugulodigastric group of deep cervical lymph nodes. Now let's look into the applied anatomy related to the parotid gland. Some of the common ones are the accessory parotid gland, mumps, which you all might have been knowing about. Mumps is really common and we all might have seen it or experienced it at some point. It is also known as parotiditis or non-suppurative, or abscess in the parotid gland, xylography of the parotid duct, blockage of the parotid duct, Frey's syndrome, it's really important, we'll be speaking about it soon, and then mixed parotid tumor or parotidectomy. Now let's look into Frey's syndrome. It is also known as the auriculotemporal nerve syndrome. Why is it called so? First, when there is a penetrating wound of parotid, they causes the injury to the auriculotemporal nerve, which provides the secretomotor innervation to the parotid gland, and it also causes injury to the great auricular nerve. So what happens is that during the healing process, the secretomotor fibers of the auriculotemporal nerve grow out and join with the distal end of the great auricular nerve and reach the sweat glands. So you can see in the figure, it joins the great auricular nerve. So what happens is, during eating, sweating also appear on the skin covering the parotid region. So the basic idea in Frey's syndrome is that, as you can see in the picture, there is a connection between the auriculotemporal nerve and the great auricular nerve. So when the auriculotemporal nerve is triggered while eating for the production of saliva, there is a stimulus in the great auricular nerve also, which innervates the sweat glands. So sweating occurs while eating, and there is also redness of cheeks while shaving, and all these symptoms occur in Frey's syndrome. This is very much clear from the picture given. So this is how it looks. This is how the sweating looks. This is how Frey's syndrome actually looks like. So I hope you're really clear about the parotid gland, its basic anatomy, its location, relations, where is it, and the clinical anatomy related to it. I hope this was interesting and thank you for listening.